Hello, my name is Dr. David Allen. I'm a retired cardiac surgeon and a member of the International Cannabinoid Research Society, ICRS. That means I'm a cannabinoid research scientist. And I'm here to tell you about the discovery of the endocannabinoid system, the ECS, and the significance and how it will change medicine. And we discovered the endocannabinoid system about 30 years ago, and we really didn't understand the significance of its discovery. And so we found out that this is a chemical communication that your body has. It's not electrical, it's chemical, and it's kind of like the hormone systems that people are familiar with. And your body makes these cannabinoids. They're endogenous, so they're endocannabinoids, and they perform some miraculous functions in the body. And we're just learning the significance of these functions. And basically, the endocannabinoid system is responsible for homeostasis. Most people don't understand what that really means, but it's the body's ability to maintain itself and function in the proper environment. And so it's critically important that doctors in the future understand this control mechanism. And we're finding out that that manipulation of this endocannabinoid system will control diabetes. It controls cancer. It controls whether you can survive a heart attack or stroke. And so this is critically important for doctors to understand this new science. And the discovery of the endocannabinoid system is the single most important medical scientific discovery ever, and will save more lives than the discovery and application of sterile surgical technique. And I'm a heart surgeon saying that. So more people will be saved by manipulation of the endocannabinoid system than are currently saved by surgery.
But recent research has been looking at cannabis and the different cannabinoids. There's over 80 plus cannabinoids discovered in the cannabis plant. The second most dominant one besides THC is cannabidiol, or CBD. Okay. And the research now is over 1,200 peer-reviewed journals on CBD. It's probably the most exciting and researched ingredient or substance right now around the world. Mm-hmm. It doesn't have the psychoactive or high that is associated with THC, but it has a tremendous amount of other benefits, including research shows anti-seizure, anti-epileptic, which is why it's gotten a lot of popularity. You do a lot with children with seizure disorders, and they're getting benefits from this plant in a safe, non-toxic way versus all these drugs that typically don't work. Mm-hmm. And there's neuroprotective benefits, so you see a lot with concussions and the NFL. There's a lot of research being done now with chronic traumatic encephalopathy, or chronically banging your head a lot. There's anti-anxiety, which is really important. It's the anti-THC of sorts. It calms you down. It helps you manage stress better, which is how I look at it. It's much more as a preventative or daily use substance than just treating disease states. And there's immune support. There's it's a huge antioxidant. There's just a tremendous. It's easier sometimes to talk about what it doesn't do than what it does.
Dr. Alan Shackelford is a Harvard-trained physician. He's also among a handful of doctors in Colorado who give prescriptions for medical marijuana. From the moment Charlotte entered his office, he knew she was in trouble. While he was just examining her, she had 2 seizures.
She'd failed everything. There were no more options for her. Everything had been tried, except cannabis.
Here's how scientists think it might work. Marijuana is made up of 2 ingredients. THC, that's the psychoactive part that makes you high, and CBD, also called cannabidiol. It's the CBD that scientists think modulates electrical and chemical activity to help quiet the excessive activity in the brain that causes seizures.
I've been telling my patients to cut.
Dr. Julie Holland is the editor of the Pot Book, a complete guide to cannabis.
For a long time, the work on cannabis and epilepsy was sort of inconclusive. Maybe it works, maybe it doesn't. They couldn't quite figure it out. And it's only when they really started separating THC from CBD that they saw, definitively, yes, CBD seems to really stop seizures.
So in the 1930s, they made tinctures. What were they making the tinctures for, and why were they doing these tinctures?
Well, I mean, the medicinal uses of hemp are just numerous. The hemp helps, well, we can talk about the cancer effects of hemp, but it helps with inflammation. It's very anti-inflammatory. It helps with seizures. It's very effective with PTSD for the vets that are coming back that have post-traumatic traumatic stress disorder.
Mm-hmm.
Very effective at treating that. It's an anti-inflammatory. But then the uses of hemp for cancer, what I've studied, because of my book, Cancer Step Outside the Box, and the number of cancers, there's about a dozen different cancers that have been studied in depth with medicinal marijuana, with hemp. And so the studies, from brain cancer to prostate cancer to pancreatic cancer, uterine cancer, cervical cancer, prostate cancer, it's amazing.
Okay, so what is in hemp that it's this THC, correct?
Well, there's chemicals that are called cannabinoids.
Right.
THC is short for delta-9 tetrahydrocannabinol.
I'm glad you said it because I couldn't.
That's the only time I'll get it right. I'm glad I got it right. So that's the one, THC is the one cannabinoid that everyone's familiar with. That's the one that's psychoactive, and that's the one that gets you high if you smoke it.
Okay.
But there's other cannabinoids. One is called CBD, cannabidiol, and it's very medicinally used. There's no psychoactive component of CBD.
So what do they do? Extract these to make tinctures, or you can make tea out of?
You can make tea. You can eat it. It's a great superfood. You're into raw. A lot of people use raw hemp in their superfoods.
Well, do you get high off of hemp if you eat it as a superfood?
No, well,
or just the seeds.
You've got to heat the THC to make it become psychoactive. So people that eat the plant, they put in a smoothie. You know, the super green smoothies.
Right.
You're not going to get high off of that because you didn't superheat it.
But is it then, if you put it in the smoothie like that, is it a good prevention to cancer?
It is. It's very well. It's got a perfect ratio of omega-3 to 6 fatty acids. It's got more GLA, gamma-linolenic acid, than any other plant. So it's got some really great fats. You're well aware of the importance of good fats in your diet.
Yeah.
So hemp it's a perfect superfood to eat, but it's also medicinal.
I just never understood why hemp had gotten such a bad rap, and now I understand that it was really politically motivated by somebody who owned basically trees and didn't want to be in competition with the hemp to make paper. And yet throughout the years after that, so many people suffered because of that.
Yeah.
So I guess it's actually a good thing that people are coming around a little bit.
It is. I'm really encouraged about the different legislation in different states that are trying to legalize medicinal hemp, because of the fact that it is so good. It's not just a superfood. It's not just great for industrial uses, as we've mentioned, but it's a really good medicine.
Thank you so much for coming on, Ty. I really appreciate you being here.
Thank you, Carol.
All right, everybody.
Hello, my name is Dr. David Allen.
And I am going to share my screen again.
Yay, welcome.
Prayerfully, we will not be kicked out again. All right, so thank you again, Kathy. So we were able to hear from a lot of my colleagues about the uses of CBD, the endocannabinoid system. I was going to take you through a little bit of history, and pretty much I do want to talk about this slide here. One of the things that I realized when I had a patient who came in February who said she didn't want me to change her medications because she felt as though she found something that was going to be helpful for her blood sugar and her blood pressure, both of which were out of control. So I give her 3 months, and 3 months she comes back. Sure enough, her sugar is so much better. Her blood pressure is stone cold normal. And she literally said, I am taking CBD. And I told her, no way. Well, it's our job as physicians to make sure that we are listening. We have to be able to listen. So if she felt it was helping, then it was my job to figure out, why does she think it's helping? And this brought me to so much fabulous information. So the first thing that I realized is cannabis itself is the mother plant. And from cannabis, you get 2 different species of plants, marijuana and hemp. And as you see, I call them the twins, because when you look at their structure, they are identical aside from one molecule. That one molecule separates marijuana from hemp, the good twin from the bad boy twin. The bad boy twin gets you high. The good twin hemp gives you health without the high. And when you look at the marijuana plant, you see that the majority of the cannabinol you get from it is THC. Whereas when you look at hemp, it is mainly CBD. Well, federally, throughout all 50 states, it is legal for all CBD products to have up to 0.3% THC. The only purpose that THC is serving is to make the CBD work at its highest properties. So when we are using these products, we are using them with the understanding that they're not psychotropic. They're not causing patients to get high. They are causing patients to experience all the health benefits that CBD has to offer, and as well as the other cannabinoids, without getting the psychotropic part of it, or without getting the high. So when you think about the endocannabinoid system that Dr. David Allen was talking about, we're talking about a system that actually already exists within our bodies, in all mammals. And so that system is comprised of these neurons here, which it's a part of the system. So if you kind of bear with me, when we have neurons, and neurons, we can just picture them in the brain, comprising the brain itself. And the way information is carried from one section of our body to the next and brought up to the brain is using neurons. And so you get one neuron and it's going to secrete something called neurotransmitters right in this little open area. We call that a synaptic cleft. From the synaptic cleft, these neurotransmitters will then bind to the next neuron. When it binds there, it activates our own natural endocannabinoid system. And so we naturally have two different kinds of cannabinoids. We have anandamide and we have 2-AG. And actually, I was doing research earlier today getting ready for this, and there are actually over 5 different ones that they've located and identified to date. So and when you think about the endocannabinoid system and how much better people feel as a result of using CBD, you can only imagine that there are going to be many, many more cannabinoids that they're going to identify in our own body that's naturally made in the near future. But for now, those neurotransmitters that are secreted into this synaptic cleft, they bind to the next neuron. When they bind to that next neuron, it activates our own natural endocannabinoid system. So the anandamide and 2-AG now come into play. They're activated. That then, those two cannabinoids will come back around to this presynaptic neuron and control how much of the neurotransmitter it is secreting into this synaptic cleft. We call that a negative feedback system. And so it's meant to make sure that we don't get too much of any one neurotransmitter. It's positive feedback because it's going to allow for the exact amount that we need to get into that presynaptic cleft. Then the negative feedback occurs as the anandamide and 2-AG are produced within this neuron postsynaptically. That'll come around and bind to the CB receptors and allow for the calming down or the balancing of that neurotransmitter. We don't want too much of anything. When you think about dopamine, if you are excited, dopamine is going to be secreted into this presynaptic cleft, into the synaptic cleft here. Well, the problem is if we have too much dopamine, it actually can lead to aggression, anger. When we talk about people who have anger issues and people who need to have counseling because they have an inability to control their anger and their urge to break things and kick things, it's usually too much dopamine. So when we have our own natural anandamide and 2-AG that comes back around in a negative feedback fashion, binds to the CB1 receptors on the presynaptic neuron, causing that dopamine to come down so that we're no longer secreting too much into the synaptic cleft, then we have that nice balance of just the right amount of dopamine so that we don't have too much, but we don't have too little. Throughout our bodies, we have CBD receptors everywhere. Heavily in the brain is CB1. Throughout the rest of the body, you can find more of the CB2 receptors. But this picture right here just shows you that we actually do have receptors for our CBD throughout our bodies. So when people are talking about they're sleeping better, their anxiety has improved. My husband, for example, we started him with CBD because of his pain. He was on the meloxicam, gabapentin, methylcarbamol, and hydrocodone. But none of those things were really getting his pain under control, and he just really didn't like the way he felt taking those medicines. When he started taking the CBD, though, it did help his pain. It's the first thing that we noticed. But a couple of months down the line, he started saying, I feel dizzy. And so when we checked his blood pressure, his systolic pressure, which is the top number, was 103. So although we were using it to bind to those areas where he was having pain, it actually helped in a different fashion. It ended up binding to the blood vessels, opening them up and causing his blood pressure to be better. And that is what we want. We want homeostasis when we're treating patients. We want balance. We don't want to have to worry about giving lisinopril, which is going to help the pressure, but worrying about it closing up somebody's throat and them not being able to breathe. We don't want to worry about giving somebody a medication for pain like hydrocodone and having them reach their maximum level or their maximum dose of the hydrocodone, with the understanding that the only thing hydrocodone is doing is blocking that pain receptor. But as the pain continues on and on and on, then the pain literally bypasses that block. And that is why patients end up needing more and more and more of the narcotic. It was never meant to be used long-term. So everybody gets themselves into a bind with the pain medication this way. So you give a low dose of the pain medicine, it works for a little while and it stops working because the pain will start to bypass it. So you go up and up and up to the highest dose you can. But what happens when you reach that highest dose and you can no longer go higher than that? Well, you can do one or two things. You can leave them there knowing that their pain is just going to continue and be chronic day in, day out. Or you can go up and risk your license, which any doctor who has any sense at all would not do that. So patients are then left in a bind. What happens when you're on the maximum dose of a narcotic, but you're still having pain? And it seems that as each new day comes in, you're having more pain and more pain. Well, then they hit the streets. Then they start to see, where else can I get it? Because the doctor just doesn't understand that I'm in pain and I need more medicine. That's the bind. That is a pickle, because the more of this narcotic that the patients are taking, the more it binds to respiratory centers in the brain, the more it binds to the respiratory centers, the more it brings down the person's ability to breathe on their own, and that's how accidental deaths are happening. Well, guess what's not found in the respiratory center? CB1 and CB2 receptors. And because of that, you've never heard of anybody overdosing on CBD or THC for that matter. So whenever we're talking about the opioid epidemic, for me, this is the perfect solution, because so far in my practice, I have been able to treat a humeral fracture where the orthopedist gave my patient Norco and Percocet. Nothing was touching her pain. But I'll be doggone if that CBD was not the winner, where she was calling me every day crying in tears. She literally stopped calling me and I had to call her. And, I was like, hey, what's up? Because, at this point, I'm kind of a little bit worried. I'm not hearing from her. Let me call, make sure she's okay. And she said, I feel so much better. I'm not crying anymore. There is so much promise to us as physicians using CBD as an alternative for so many of these pain medications. But how about thinking of it from a different standpoint? How about the person who is a pre-diabetic and the person who is pre-hypertensive? If we're able to start them on a good regimen of CBD, we maybe can keep them from needing to be on a true prescription, or maybe we can at least prolong the time before they need to be on a prescription. And, you know, when it's all said and done, we as physicians, we do want to do as much as we can in a natural manner. We want to do what the body was meant to do. We want to give the body what it was meant to have. But, you know, we've never been taught about this. There are things that we were not given the information for. We were not privy to this information for so many years. However, now in medical schools and pharmacy schools, there is intense teachings on CBD, because it's going to be an essential part of what we're doing in the future. So in my practice, I've seen it for myself. I have seen it help with anxiety. I've seen it help with sleep, insomnia. Matter of fact, I just had a patient who started on some samples on Friday, and she called me to let me know for the first time in forever, she did not need her Ambien, nor did she need her Klonopin. She had the best night's sleep with Wakana CBD products. That speaks volumes, because you know how it is with those medicines. This is the same person who told me, look, I can't run out. You can't make me miss my medicine because I will not sleep. So a lot of promise. We have these CB1, CB2 receptors throughout the body. And just so you can understand what is going on here, the CB1 receptors are mainly responsible for motor activity, thinking, motor coordination, appetite stimulation, short-term memory, pain perception, immune cells. And so when we have products that are binding to those CB1 receptors, these are the different symptoms that we're helping. Creativity, ability to focus. I have been able to get patients off of Adderall and Vyvanse and use a regimen of products from Wakana, and it's a combination of the tincture and the gummy, and help them to stay focused and actually help them with their creativity. So projects that were started and never completed are now getting completion, and new projects are being started and completed. CB2 receptors, we're talking more organs everywhere else, the gut, the kidney, pancreas, fatty tissue, skeletal muscles, bone health. Breaking a bone, the CBD can help with the healing process, which you're going to see in a minute as well. But all of this comes to us as something that is foreign, of course, and it's a bit scary and intimidating, but we have to do our due diligence in learning about CBD, and we want to make sure that we're giving our patients the best options for every single health issue that they may have. So although we came up with the thought that all things cannabis related were illegal, what pretty much happened is, as they said in the video, it was all about trees. But fast forward to 2014, so many trees have been cut down that literally the earth is being destroyed. You know, the sun's rays are scorching the earth. So many nutrients are no longer in our foods. We have less than half of what we had in nutrients when we compare what we have today versus the 1940s and 1950s. Well, in 2014, Save the Tree initiatives were heavily found and seen and heard everywhere. And so if we are not going to be able to use trees, what are we going to use? Somebody has the sense to say hemp was never bad. So 2014 U.S. Farm Bill came out and it protected hemp. Is it good? Is it bad? We're going to research. Let us do our due diligence and see exactly what is happening here with this hemp. And by 2018, it was decided and concluded that it was not a drug. It was taken off the controlled substance list, made legal in all 50 states. And that's why you started seeing CBD stores literally coming up every which way you could turn, even convenience stores. What is CBD? Cannabidiol. It naturally occurs in hemp. There are actually over 100 different cannabinoids now. CBD is the second most common. THC is the most common, but THC causes you to get high. It has psychotropic effects, but CBD gives you health without the high. All of our products with Wakana are all in compliance with federal regulations. We have full spectrum products, meaning they have all of the different cannabinoids, including THC. So if anyone has to do drug testing, you want to stay away from the full spectrum products. But we do have broad spectrum products where as much of the THC as possible has been extracted. And so there's 0.0% THC. So if you have to do drug testing, you want to stick with the broad spectrum products. But the products are also made by organic methods. Listen, Wakana is so serious about what they are doing that even the dirt gets tested by third-party lab. But not just the dirt. Also, every single product that comes out of Wakana is tested by a third-party lab that specializes in hemp. We want to make sure that there are no chemicals, no pesticides. We want to make sure you're getting the highest quality product that we can possibly offer. And we also want to make sure that we are teaching the right things for you to learn and for you to unlearn the lies that we've been fed. You know, THC does have the psychotropic effects. It affects the brain's pleasure centers. It releases higher than normal dopamine levels. That's where that euphoria and that high comes from. CBD, on the other hand, it's not psychoactive. It does not cause you to feel high. It's not intoxicating. It stimulates receptors in the brains, but in such a way to help with pain, to help with anxiety, to help with insomnia. It gives you health without the high. It is a very, very, very strong anti-inflammatory. And this slide here just shows you the many, many, many wonderful benefits of CBD. Now we have the different cannabinoids up here. THC is first. And if you take a good look, you see it really doesn't have all that many health benefits. It helps with pain, yes, it helps with nausea and vomiting, and it helps with muscle spasms. But look at good old CBD over here. Look at all of these amazing health benefits that we can get from CBD. And because our products are full spectrum, you can get the benefits of all of these different cannabinoids all in every one of the products that we have that are full spectrum. Now, again, broad spectrum, as much of the THC has been taken out, but we can still enjoy the health benefits that we can get from all the other cannabinoids. So I know my time is limited. It's already 7:44. So I'm going to try to go through some of our products. Again, we have a pure line and a power line. Power equals full spectrum. If you have to do drug testing, please stay away from the power line. Pure is the same as broad spectrum. As much of the THC has been taken out as possible. And I'm going to apologize right now, everybody, because I think my dog's about to start barking. We have products in all kinds of different industries. All of the industries that are booming throughout the US, we have a product for you in that industry. And that is just the foresight that our founders have to ensure that not only CBD, which is booming, but we also have products in skincare, essential oils, weight loss, wellness and the immune system, and hair care. Just to give you a glimpse of the different types of products, we have tinctures. Tinctures that go under the tongue. We want to start with just 3 drops under the tongue. Just remember this. We always want to start low and slowly titrate up. You can always go up, but you cannot take it back. Our products are of the highest quality. So I have so many patients who will say, oh, only 3 drops, doc? Yes, only 3 drops, because Those 3 drops with our power line, each drop contains 1.6 milligrams of CBD. And we want to start with just those 3 drops because you never know. That might be all you need. And I'm going to be honest with you, for the majority of my patients, 3 drops is all they actually need. You let those 3 drops sit under your tongue for about 2 minutes, 1 to 2 minutes, and it will absolutely be in your system at its peak in about an hour. So we want to use the tincture, put it under the tongue, and it'll last for about 4 hours or so. Now, the next thing we have are our power gummies. What sets our gummies apart from all other gummies is that our gummies are infused. So every bit of the gummy you bite into is filled with CBD. That makes our gummies more potent than the average. And listen, we've had to make believers out of the millennials. We've had to make believers out of a whole bunch of men who felt like, I need more than 1/4 of a gummy because our gummies are so potent. You only need 1/4. And you want to start with 1/4 because, again, you want to start small. I'm so sorry. Y'all would think that my husband would come to my rescue, right? But I don't think he realizes. You want to start with 1/4 of a gummy because it is infused and it is that potent. And once you start with 1/4, that will get into your system in about 4 hours, and it'll last 8 to 12 hours. The premium flower here, this is the fastest way that you can get CBD into your system. Any of our smokable hemp can get into the system in about 1 minute. And so if you're having panic attacks, if you're having anxiety attacks, if you're having acute pain, you want to make sure that you have some smokable hemp on hand because it is going to be the thing that gets into your system the fastest, the quickest, and give you the fastest relief. And our pain cream, which is my absolute favorite product, this I call my miracle cream because I know undoubtedly I can give any patient, when I walk into the room, my first question to my patients is, do you have any pain? And if they have it, and look, it's exciting when they do because look, I have the right, look, I have the thing for you. I am gonna always ask the question because I wanna put it on because I know by the time my visit is done with my patient, they're gonna feel the relief. And they're gonna walk up to my receptionist and ask to buy some of that power pain cream. The pain cream is going to work in about 5 to 15 minutes. And I've actually had people tell me it lasts for a few hours. I've had people say it lasted for half the day. One of my friends just told me it worked for her for a full 24 hours. So of course, individually, different products are gonna work for different people in different ways. But what we want to do when we talk about a chronic issue, when we're talking about chronic pain, when we're talking about generalized anxiety disorder, insomnia, we want to layer these products so that we have a steady stream of CBD within our system throughout the day 24/7. So let's talk about chronic pain. We want to put the power cream on. We want to put 3 drops of the tincture under the tongue, and we want to take 1/4 of the gummy. So we know that the cream is going to start working right now, right? And when that cream is maybe wearing off, which for most people, 1 to 2 hours, we know that the oral drops are going to be kicking in. And when the oral drops are kind of fading away in about 4 hours, we know that the power gummies are kicking in and they're gonna last 8 to 12. So if you do that twice a day, you have a good stream of CBD throughout your system and you have the best relief that you can look for with our products. We also have other smokables. We have the pre-roll and we have other vapes and different flavors that you can use. And we have the hypnotic here, but we also have Delta 8 vapes, which will give you the quickest relief. We have an assortment of gummies. We have gummies for sexual wellness, which King of the Jungle, which is our first product here, is our main player in our sexual wellness line. This King of the Jungle is going to increase your libido and your stamina. Great for men and women. But this is a very, very good alternative to things like Cialis and Viagra. We don't have to worry about your heart stopping, your blood pressure dropping too low. King of the Jungle is going to, like I said before, that CBD will give you balance throughout your body. So the King of the Jungle will add that spice to your sex life that you're looking for without those horrible side effects. The Delta 8 gummies for creativity. We're talking about ability to focus better, to concentrate more. A lot of people who have issues with attention deficit disorder, issues concentrating, do well with this, but it also helps creative minds think better and come up with more projects and more ideas. And this caution sign above it is there because it is the closest thing that you're gonna get to the real deal. So whenever you're thinking about using one of the Delta 8 products, if you've ever had trouble with the real deal, you wanna steer clear of this. For everyone else. Great for creativity, but do not forget, start with 1/4. Pure gummies here, these are for those who have to do drug screens or those who just want to start off with the pure broad spectrum gummies. It will help with stress and rest and anxiety. It will do the job that you're looking for it to do as well, but without that 0.3% THC. And again, here we have the Power Gummy. We have a line of culinary products that we can use with our foods. We have the CBD butter, and we have infusion drops that we can add to our drinks. A full line of products for our defense, especially right now when we're dealing with COVID and the flu. This First Defense nasal spray I have to speak on simply because that nasal spray will give you some instantaneous relief. It does have THC in it though. But if you are a chronic sinusitis person, I promise you, this thing right here will open up everything. And you can literally feel the fluid moving from your inner ears as the sinuses are shrunken and that swelling in there is relieved and the fluid is able to drain out. But there's also a central defense that you can put on the toothbrush, the immune defense tea to boost your immune system, and other products for produce, for hard surfaces, and even for your hands, to sanitize your hands. Alcohol-free, 99.9% of the germs are killed, works up to 24 hours, just like that microban can do, but it's lab certified and it's all natural. Weight loss, we have the most amazing weight loss program going on right now, Flat Belly Lifestyle. We want this pack here to go out to as many people as possible. We have good, natural, lifelong changes that we're implementing for healthy weight loss. And it starts with this pack here. Bitters tea, you use it over 4 days, 8 ounces over 4 days to cleanse your colon, because healthy weight loss can't start until you have a clean colon free of the toxins, able to have that good balance of good and bad bacteria, and able to absorb the right nutrients for us to boost our metabolism. The Flat Belly gummies have Caralluma fimbriata, which is an herb that was used to help with appetite control, used centuries ago when people had to walk, long distances to help control their appetite. Well, we have the pleasure of having it in our Flat Belly gummy. And it doesn't just take your appetite away, but it helps you to make better decisions about the food you're gonna eat. And the Flat Belly Brew, which is a gourmet coffee filled with CBD plus Garcinia cambogia to prevent that fat storage from happening too much, and green tea to boost our metabolism, to speed up the fat burning process. But this comes in a package, or you can buy them individually. But if you combine this with our Flat Belly Lifestyle 2.0 program, you are guaranteed to have some tremendous weight loss, just lifestyle changes. You're gonna feel absolutely amazing. All you have to do is take the pledge. Get with the person who invited you to this meeting to find out how you can become a part of the Flat Belly Lifestyle. But our CEO, Melissa, is somebody who not only wants you to just lose weight. We don't want to just give you a pack, take the pack, and that's it. We want you to truly change the way you look at foods. We want to be able to equip you with the right way to shop. What are the proper ingredients that I'm supposed to get? With this program, you get an ebook with recipes, you get a grocery shopping list, you get all the tools that you need for healthy weight loss. Power King to Chaga, the CBD combined with the chaga mushroom. This is our super multivitamin right here. It's the only one that comes in a capsule, but anti-inflammatory properties, antibacterial, anti-tumor growth. That's right, anti-tumor growth. It boosts your immune system, but it can also help with your cholesterol and your blood sugars. We have a whole line of essential oils, and if you don't know anything about 4 minutes left. If you don't know anything about black seed oil, please, please, please look at it. It is great. It helps. It's antibacterial. It helps with your skin and your hair. It's anti-inflammatory. It actually will help with your pancreas. It'll cause an upregulation of the beta cells and allow your pancreas to naturally produce more insulin, and that is how it helps with blood sugars. The full sexual wellness line, there's lube for the G-spot lube and cherry bliss lube. The cherry bliss lube, I actually was looking at that again, and it actually helps with vaginal atrophy as well. And we have the hair care, hemp power hair, drops that go on the scalp, but you can use it orally as well as tincture under the tongue. But putting it on the scalp, it'll help with the follicles. It'll help reduce inflammation in the follicles, make those follicles healthier so that it can produce longer, stronger, and healthier hair. And for guys that are looking for that full beard, we have the beard and scalp oil for you. Combine that with the SOS hair care system, which is the Save Our Strands hair care system. You will have stronger, healthier hair. You will regain your crown of glory. And when I tell you, this has made a tremendous impact for me, who lost a lot of hair after a tragedy we had to deal with 2 years ago and still continue to deal with today. But I can tell you that I have my crown of glory back because of this SOS hair care system. I actually had a patient who stopped me today and said, golly, doc, your hair really grew back. What are you using? What's And I showed her, and she bought it right then and there because she knew. She saw me before the tragedy, she saw me right after the tragedy, and she sees me now. So we're talking about products that really work. And this concludes all the products. I'm sorry I had to run through it, but I want to get to these questions here. If there are any questions. Hi, hey Janine. Hello to everybody. Thank y'all for sticking in there with me. Yes, Lisa, look, y'all, I hope y'all can read this, what Lisa put. Thanks for your advice about how to spray the nasal defense toward the sides of each nostril and not toward the back of the nostril to minimize that strong tingling sensation, because let me tell y'all, it is gonna work. If you spray it straight up, telling you, it's like, it's for sure like a blast, but you can spray it towards the sides, inner or outer sides, and it's gonna still give you the effect of shrinking those turbinates in here to open up your sinuses the way it's supposed to. And Ms. Beatrice said she uses a Q-tip. That's another great point. Thank you so much. So I am going to stop sharing. And I truly appreciate all of you hanging in there with me. I am sorry for all the technical difficulties, but I hope you got some great information from the little bit of information I was able to share with you. And so I am gonna be on my way, and I believe Dr. Joy is coming on next.
I am. I'll start up as soon as we're done with questions.
All right, okay, any other questions? Y'all are welcome. Y'all are very, very welcome. Okay, I don't see any questions, Dr. Joy. So I am gonna be out of here. I'm gonna get back on with you. But thank you, everybody. Sorry again for technical difficulties, but I appreciate your attendance. Have a good night.